Hello, my friends. Happy New Year. I hope you're all enjoying the Bahamas, that you've got Mai Tais, you've got pina coladas, you are enjoying the beach. Dr. Bray, thank you so much for this opportunity to spend a few minutes sharing my thoughts about 2019 and where I see our profession going. So it's exciting times. The hot topic on the street right now is big box braces and braces in a box. I receive so many phone calls every week, literally every week, asking about how do I compete, concerns about Smile Direct Club being next door, Candid Smiles, and $3,000 braces. So what we're going to be talking about is the changes in orthodontics, how you can think different, and basically thinking outside the box. We're going to start with scheduling a new patient exam. We're going to talk about the patient experience and creating a community voice. So scheduling a new patient exam, we absolutely have a different consumer now. The consumer has very high expectations. They are impatient. The consumer that we have now needs to be seen in 1 to 5 days. That's the sweet spot. Having our patients wait 6 to 8 weeks for a new patient exam no longer works. And the consumer is educated. They're getting a lot of their information from commercials on TV, from the internet, from ads, and they're hearing that braces are $3,000. For 28 years, I have passionately defended my position that you should never quote a fee over the phone. And things are different, times are different. And now I actually tell you, if you are asked to go ahead and quote a fee. The consumer has an enormous amount of information. They already have a dollar amount in their mind because of all the advertising. So you have to be willing to quote that fee, but how you quote a fee is what matters. So if somebody says, how much are braces? Tell them, gosh, that's a great question. So our fees are based on the type of treatment, the diagnosis, the length of treatment, and your insurance. However, our payments can be as low as $99 per month, and the average range is from $2,000 to $5,000. It does need to be scripted. Your team needs to know what to say and how to say it. The caller has to feel like you're not dodging their answer, that you're being helpful, and they need to understand that your fees and your financing are competitive. I get questioned a lot about, well, $2,000 to $5,000. Leanne, is that fair? What I'm seeing out there is fees are actually going down. Part of the reason that the average case fee is going down is because more people are adopting a compromised treatment. It's their way to compete with the Smile Direct for the Invisalign stores. So a $3,000 fee, is that something that I'm promoting with my clients? No, we are going a little higher than that, but I am promoting having a compromised treatment, if that's what the consumer is asking for. American Express in 2017 did a survey, and they found that the consumer in the United States is willing to pay 17% more to have a better experience. Interestingly, millennials will pay 21% more. So what am I saying to clients as far as coming up with what their compromised fee is? I'm saying, go ahead and price it somewhere in the area of $3,600 to $3,700. And make sure you have an amazing experience that differentiates your practice versus braces in a box. For some clients, we even have them quoting on their website, just to get that out of the way and giving people a range and a way that they can go ahead and make their monthly payments. Your new patient needs to be able to schedule on your website, not just by phone. So yes, a lot of our patients telephone in, they make the traditional new patient phone call. However, most of your consumers are researching you after 5 o'clock and on the weekends. So you have to be able to allow them to schedule an appointment, not request an appointment, but actually schedule an appointment time so that they feel the hunt is over, they have an appointment next week, and they can move on to other things. Most of the software programs out there don't allow you to schedule. So get a system, an app, or any software program off the shelf. Go ahead, put appointment times in there for your patients to be able to schedule new patient exams, and make sure you monitor that software. That way you can add that patient into your schedule in real time. As I mentioned earlier, we need to be able to offer new patient exams in 1 to 5 days. That's the sweet spot. So we do that by offering 3 types of exams. You have your traditional exam. It's a 1-hour exam. It's usually 8 to 12 minutes of the doctor time. And now we have a TC-only exam. That's when the patient sees the treatment coordinator. The doctor does the diagnosis. The doctor is in the office, but the patient isn't having a clinical exam with the orthodontist. And then we have the virtual exam, which is no doctor time at all. A practice that does traditional new patient exams averages about 7 exams per day. They can see 4 exams in the morning, typically 3 in the afternoon. So for the TC-only exam, we take full records when the patient arrives. We do a tour of the practice. We introduce our amazing doctor during the tour. The TC takes the patient in. She does her meet and greet. She identifies obstacles, trial closes, and when she's done with her meet and greet, she steps out and she briefs her doctor. The doctor has looked at the records, and the doctor is going to give us the diagnosis, the treatment plan, the treatment time, and the TC is going to go back into the exam. She'll present the treatment, she'll present the finances, and she'll get the patient started. So the TC-only exam, as I mentioned, is 40 minutes long. And as I mentioned, it allows up to 10 exams per day. You could have 6 exams in the morning and 4 in the afternoon. However, the reality is not every patient is going to be a TC-only exam. But every office should have a blend of a traditional exam and a TC-only exam. The financial rewards are enormous because if a doctor averaged 14 patient days per month and was to add 1 more exam per day because he was using a TC-only exam or she was using a TC-only exam, that would be 14 more exams per month. Think of this, with a 75% case acceptance, okay, that's 10 more starts, $5,000 a case. That's $50,000 more per month. That's $600,000 a year. So on the business side of it, it's amazing, wonderful benefits. On the consumer that we have that wants to be seen in 1 to 5 days, that is impatient, we're getting that consumer in sooner and reducing the risk of the patient going someplace else. The virtual exam is where we really have to think different. The medical profession has been using a virtual appointment for over 3 years. There's even insurance codes for a virtual appointment with a doctor. If you go to the Portland airport, you will see they have a pharmacy there, and then they have a consultation room that you can do a virtual appointment with a physician. So if you're a traveler and you're not feeling well, you can see a doctor in a box at the airport and walk out and get your prescription filled. In orthodontics, we're not saving lives, we're just changing lives here. We're straightening teeth. So the virtual exam is appropriate for us. They have their place, but what's most important is when you adopt a virtual exam that you have to differentiate your practice from braces in a box. So how do you know who to schedule and where to schedule these different types of exams? Well, you've got to ask right questions. So asking the patient's age, their referral source, their main concern. Are they thinking of traditional treatment or aligner treatment? You want to listen to what people are saying and constantly trial close them. A simple place to start if you want to start doing TC-only exams or virtual exams is start with siblings. They already have a relationship with your practice. They already love and trust you. Begin with your observation-ready patients. They've either already had treatment with you or They've been coming to you for 3 or 4 appointments, and they've already met the doctor. Clients utilizing the TC only and the virtual exam correctly are not seeing a decline in their case acceptance. Doctors, the patients love you, but they're really not missing you in the actual consultation. So where do we go from here? Well, from here, it's our job to educate the community that the first and only choice for their treatment should be a specialist. So how do we go about doing that? One is you have to strengthen your voice in the community. We don't have $50 million for commercials, but we need to silence that noise organically. And the best advice is recruit your patients and recruit your parents to be your voice. Start building alpha moms. And what I mean by that is parents love to talk about their children, but they love to talk about themselves more. So if you really want to get a mother talking about your practice, get her in treatment. And make sure that you have an amazing experience at every appointment. It's got to be memorable. A good experience is not enough to get a referral. So you've got to get your entire team to think different. The team has to commit to concierge service from start to finish. Our assistants have become obsolete. And please don't shoot the messenger. The reason I say the assistants are obsolete is because Google said so. You don't see people write Google reviews because of great scans, great bands, great arch wire changes. They write reviews about how people make them feel. So our clinical assistants now have to be a clinical concierge. Our scheduling coordinator has to be a scheduling concierge. And that is true for everybody on the team. We have to think different. When we're recruiting new team members, we don't have to look for people with orthodontic experience. That doesn't trump everything else. We recruit people who can create a memorable experience. When you recruit new team members, you need to communicate your standards. You need to set measurable expectations. Develop departments. You have a scheduling department, a clinical department, a financial department. Orthodontics is no longer a mom and pop profession. It's a business and it's an industry. So we have to think different. We have to be different. We've got a great generation of orthodontists out there. We've got a great generation of entrepreneurs, and they're both pushing us forward. This is a generation that doesn't just think outside the box. This is a generation that says there is no box. I'm going to end my remarks basically where I started. We have to think different. We have to be different every day. I know you can take it from here. So thank you again for allowing me to share my passion, my experience. The Schulman Group plays at the highest level. You set the bar that others aspire to be. Thank you for letting me be a small part of your meeting. Have a great time. Cheers. Am I done?